Dr. Lucy Mecca, and we've got Ruth Wanjala from Path. The World Health Organization chose Malawi, chose Ghana and Kenya to vaccinate 360,000 children per year, and the two nations already began the rollout in April. And as you have been told, Kenya is yet to start, but of course it will be in the last quarter of the year. Any questions that you have concerning the vaccine, will you send that to us on our Facebook page, KBC English Service. Like the page and keep your questions coming. Even as we talk about malaria being a burden, could you talk about some of the areas that are hardest hit by malaria?
We see a high burden, especially in Nyanza and Western. Those are the lake endemic regions. We see 27% of the population being infected with malaria. And then we have also the coastal region, about 11%. So these are the regions that we are looking at having quite a high burden of malaria.
Why do you think these particular areas are prone? The lake region and perhaps even the coast?
I believe it's the patterns of the, actually the vector. That is where the vector is able to breed, and actually the environment in which the vector is able to thrive. That is the mosquito, and the type of mosquito that actually transmits malaria, that is the Anopheles, which you find quite prevalent in these areas. We have what we say are the early signs of malaria, that is fever, headache, muscle aches. But if they suspect that they may have malaria, then they need to visit the nearest health facility and be able to get the appropriate diagnosis and treatment.
And we've got Ruth Wanjala from Path will also tell us about what are the existing threats in eliminating malaria in Kenya. Perhaps you could just tell us, those threats that exist in eliminating malaria in Kenya.
We have seen a lot of progress in terms of fighting malaria in Kenya. There's been a lot of effort. We have things like the nets, the insecticide-treated mosquito nets. We have interventions like IRS, the indoor residual spray that is happening in parts of Nyanza and Western. And then we have the whole issue around appropriate diagnosis and treatment using what is recommended by the ministry, which is ACTs. So with these interventions, if they are not used appropriately, those become threats. If people do not get the right diagnosis on time, if people don't get the right treatment, if people don't use the recommended interventions like the nets and the IRS that's recommended. But we have to commend the Ministry of Health. It has done really well, and as a result of these interventions, we have seen malaria going drastically down, especially between 2010 and 2015. And because of that, we have more children being saved. But however, like my colleague has said, a malaria vaccine as an additional intervention would help reduce even this burden further, and then we'll be able to eradicate. So to answer your question, we have the recommended interventions, but when these interventions are not used as they should be, it becomes a threat to malaria elimination.
We first of all talked about those who are diagnosing themselves, but that aside, now the person who goes to the hospital and then gets misdiagnosed, have you had such cases, especially with malaria?
Malaria program has very good guidelines in terms of diagnosis. They have recommended what to use, and clinicians, especially in the malaria endemic areas, are well aware of the procedure and the process towards diagnosis. There are symptoms that are usually there, as my colleague said, in terms of fever, in terms of headache and muscle aches. And with those symptoms, if you go to a health facility and with the guidelines that are in place, you should be able to get good diagnosis and proper diagnosis for malaria.
Thank you so much for finding time for us.
Thank you for having us.